Well, hundreds of thousands of people impacted by radioactive waste left behind during World War II are now applying for benefits. And according to the Justice Department, they've received 174 applications and 6 people have already been given some funding. So that is promising. But we've been saying 300,000 people may qualify for the Radiation Exposure Compensation Act. We call it RECA. Those living in 21 zip codes near Coldwater Creek could be at a higher risk for cancer. Dr. Kanika Cunningham from the St. Louis County Health Department is here to talk about the numbers and cancer screenings. Thanks for staying with us this morning.
Thank you, thank you.
These are really big numbers. 300,000 people, 21, almost 2 dozen zip codes.
Yes.
And will those numbers change at all? Will we be adding zip codes? Do you know?
Well, at this point, I'm not certain.
Okay.
I'm not sure. Maybe the further we get along, possibly. But right now, those zip codes cover a significant portion of North County, and where we see a lot of the exposure still potentially remaining. So I think at this point, continuing to encourage people to talk to their doctors, talk to their doctors.
Sure.
And
I get it. It's early. I know.
I know,
No, but that's so important, and maybe they can get screened, right?
Yes, yes, correct, yes. So one thing that we are seeing that individuals from those impacted zip codes have an 18% higher chance of developing one of the cancers that's associated with radiation. So, and for some of those cancers, we have standard screening guidelines, but for a lot of them, we don't. For example, multiple myeloma, we don't have recommended screening guidelines for that. So it's important to talk to your doctor, talk to your provider, whoever that may be, to identify what is your individual risk, knowing that this environmental exposure exists in North County.
And you mentioned in the 6 o'clock hour, something like 80% of folks could be impacted.
Right, correct.
That's incredible. That's a huge number.
It is. And this is the first time RECA has included survivor benefits. So if your loved one passed on, children of descendants, this is the first time. So therefore, there's multiple people that could be eligible based off of the new criteria.
That's wow. I'm just curious, and not to put you on the spot, but do you think there's a chance that money could run out? So is it important to get screened or to start your application?
Well, I think there's two different things. I think there's one thing with the application to apply for benefits, given that you were impacted, you or your family. But from a health perspective, the risk is still there. It was there years ago. It remains right now. And so educating the community, what is your cancer risk? And are you up to date on your current cancer screening guidelines? So I think that's the second message is, yes, we have this application, but the deadline to submit the application is December of 2027. January of 2028, that risk still exists. So even beyond the application, thinking about your health, your well-being, the communities who were impacted, and having this discussion so that we can save lives.
Yeah, and I think one of the headlines is, oh gosh, money is available, right? But at the end of the day, money's not worth anything if you're not healthy or if you've lost someone.
That is correct.
What other cancers are we talking about potentially?
So other cancers that involve bone cancer, brain cancer, ovarian cancer, liver cancer, leukemia if it was diagnosed after the age of 20, multiple myeloma, breast cancer, of course. I think one thing that we're seeing in North County, that breast cancer is the most commonly RECA-associated diagnosed cancer, but just in general is actually the most diagnosed cancer in North County right now. We're seeing higher mortality rates, so people dying from lung cancer followed by breast cancer in North County. So the cancer risk and impact is there, and we need to have this discussion.
Wow. I'm sorry, I'm just blown away. Do you know what I mean? It just seems like it's taken so long to get to this point.
I agree.
And then the numbers are just blow you out of the water. You know, it's incredible.
And it's a lot of people, I think they're still not even aware. I've been doing some community events and there's older people coming up, oh my goodness, what is this about? I don't know. And so there's a lot of education and community support. There's some great organizations out there helping Just Moms, STL, St. Louis County Library. So first thing, we need to educate individuals, but then take it a step further and think about the current risks that still exist.
And then just finally, what would you recommend to folks who are watching this and maybe discovering something something new this morning, whether it be screenings or just where to get more information.
Right, so definitely you can visit the St. Louis County website, the RICA website. You can Google that in, it'll pop up as your first hit at the top. Number two, I would recommend you talk to your primary care provider to let them know that this environmental risk exists, and going forward, what do I need to do to keep myself healthy? The health department, we are releasing a health alert to all of the hospital and organizations, community health centers, informing primary care providers, so therefore when you have that conversation, your doctor is aware that this exists.
Okay, Dr. Cunningham, thank you so much for your time this morning and staying with us.
Thank you.
Really appreciate it.
Thank you.
All right, well, thousands in St. Louis will be affected as the government shuts down. What federal services are at risk? Still ahead.